Hey guys, welcome to my channel. Having a negative pregnancy test result doesn't always mean you are not pregnant. There are several reasons why your pregnancy test result is negative when you take the home test, but you're having all the signs and symptoms of pregnancy. So I'm going to be talking on two factors which could be responsible for this. They are the false negative and the false positive. The first one, which is the false negative, means that you could actually be pregnant, but your test result is negative. While the second one, which is the false positive, means that you are actually not pregnant, but you are having the signs and symptoms of pregnancy. Now, let's talk about the first one, which is the false negative. How is it that you are actually pregnant, but yet you're having a negative test result? Yes, it is possible, and it could be due to some factors I am going to be discussing with you right now. Number one is testing too early. If you are actually pregnant and you test too early, you might end up getting a negative test result, and that's because the HCG at that point is very low. The full meaning of HCG is human chorionic gonadotropin. It is an hormone that is usually produced during pregnancy. That is why it is advisable that you wait after you've missed your period, like days after you've missed your period, to take the test. If not, if you test too early, you just end up getting a negative test result. Number two is using expired or faulty test strip. It is important to check your test strips very well to be sure that it is not damaged or it has not expired, because if you take the test using a faulty test strip or an expired test strip, you will end up getting a negative test result. Number three is taking the test wrongly. Always make sure you follow the instructions on how to use the test strip before using them. Each test strip comes with its own instructions. If you put the urine wrongly or it passed the level where it's supposed to get to, you end up getting a negative test result. Number four is overly diluted urine. To get an accurate test result, you need to take the test first thing in the morning when you just get out of bed. This is when your urine is more concentrated. It makes it easier for the HCG to be easily detected. During the day, you might have taken enough fluid, which would make your urine diluted. The more diluted your urine, the lesser HCG will be present. So if you take the test during the day when your urine has become diluted, you will get a negative test result, or it could be the reason why you've been getting a negative test result. Number five is checking the results too soon. Pregnancy test strip comes with instruction on how long to wait after taking the test, which is usually between 2 to 5 minutes. It depends. Yes, you need to wait because the antibodies in the test strip need time to detect the HCG in your urine. So when you take the test, like you just check the test immediately, you might see a negative result, or you might get a negative result, and when you come back later to check, you see that it's positive. So checking too soon might be the reason why you're getting a negative test result when you're actually pregnant. Number six is miscalculated menstrual cycle. Most women don't know how to calculate their cycle, and they don't even know how to track their periods to know the length of their cycle. Just because you hear that majority of women have a 28-day cycle, you quickly assume that, oh, I also have a 28-day cycle, without doing the proper calculation to know how long your cycle is. If you have a longer cycle and you take the test too early, you might end up having a negative test result when you are actually pregnant. All these factors I just talked about now are under the false negative, which are reasons why you are having a negative test result when you are actually pregnant. Now let's talk about the second one, which is the false positive, which means you are actually not pregnant, but you are having the signs and symptoms of pregnancy. What could actually be the reason for this? Number one is irregular cycle. It could be that your period is about to come out. Menstruation has some similar symptoms with pregnancy, which is known as premenstrual syndrome. Some women find it difficult to calculate their cycle when it is irregular. And when you have an irregular cycle, you could miss your period for 1 month, 2 months, or even more. So if you take your test when you're having premenstrual syndrome, you will definitely get a negative test result because you are actually not pregnant. Number 2 is you might be ovulating. Though you won't get all the symptoms like in premenstrual syndrome, but you're likely going to experience symptoms like headache, breast tenderness, lower abdominal pain, and nausea. So if you don't know how to calculate your cycle, and you don't know the signs and symptoms of ovulation, you might end up mistaking the signs of ovulation for early signs of pregnancy. I have a video on the signs and symptoms of ovulation. Do well to check it out. So if you take a test at this point, you will end up getting a negative test result because you are actually not pregnant. Number 3 is side effects to fertility treatment. If you are undergoing fertility treatment, those medications are designed in a way that they elevate your hormones. And this increased hormonal level can cause symptoms that are both similar to premenstrual syndrome and also pregnancy. So if you take the test when you're having these hormonal increased symptoms, you will definitely get a negative test result because you are not pregnant. Number 4 is premenopausal symptoms. Premenopausal symptoms are similar to pregnancy symptoms, and some women tend to experience these symptoms as early as their mid-30s. So if you take this pregnancy test when you're experiencing premenopausal symptoms, you will definitely get a negative test result. Number 5 is hormonal contraceptive method. When you start taking hormonal medications newly, you tend to start experiencing skipped period and irregular cycle, which is normal because you just introduced new hormones into your system and your body needs time to get used to these hormones. So guys, if you take the test at this point, you are definitely going to get a negative test result because you are not pregnant but reacting to the hormonal medications. And number 6 is psychosomatic disorder. This is a psychological condition. This is when a woman who is ready for a baby or a woman that is suffering from infertility wants to get pregnant so badly that the brain focuses on these symptoms. They wouldn't want to know if it's premenstrual syndrome or if it's ovulation symptoms they are having. They just feel they are pregnant, and after testing they end up feeling discouraged and sad. Thank you guys for watching this video. Please don't forget to subscribe and put on your notification bell so that when I upload a new video, you'll be the first to get notified. And don't forget to like this video and also drop a comment. Let me know if you have any questions you'd want me to answer, or if you have any topic at all that you want me to talk about. Do drop them in the comment section. Please share this video to your family and friends and to your YouTube communities. Thank you so much, and see you in my next video. Bye.